We do have 10 minutes for questions, so please get some physical activity, stand up and go to the microphones and get your questions ready for these extraordinary scientists. While we're waiting for you to follow that advice, quick question. If you could identify, besides dealing with the stray dog issue, for both of you, if you could identify one public policy change that would be inspired by some of your research conclusions that could have the greatest impact on increasing physical activity among children, what would your policy recommendation be?
May I?
Please.
I would say that physical activity patterns are established early and start early. You don't want to wait until children are school-aged. You want to find opportunities for policies and programs when children are younger, and you need to align it with what is normal development, rather than sort of imposed restrictions, such as 30-minute structured play. I, as an adult, would love 30-minute structured playtime, but for a preschooler, we're going to reinforce all of these habits, as well as the metabolic outcomes that you heard earlier, if we develop programs intentionally with that developmental phase in mind.
I would very much like for us as a society to rediscover outdoor education and outdoor exploration, and I think that might make a great difference, although I don't know how we do it with policy. I actually have a disclaimer for Sherry. I'm doing my part for stray dogs. I own 5 dogs.
And you keep them on a leash?
No, actually, but I live out in the country.
I think we have a question.
Hi, I'm Loretta DiPietro from the Milken Institute School of Public Health up the street. You both addressed the topic of moderate to vigorous physical activity versus sedentary behavior. Where is the role of light activity? Because that's mostly what gets displaced with sitting. So have you thought about adjusting for total physical activity, not simply moderate to vigorous physical activity? I mean, have you explored that very gray area?
Yes, please, go ahead.
In our data set, we have thought about that, and I don't think that children are the same as adults, and I'm going to come out and tell you opinion by Jan's. I think it really is moderate to vigorous physical activity that we need to see real movement in terms of seeing positive associations with reducing adiposity in children. I don't know if that's the case with adults, and we have looked at our data as in many ways as possible, and always MVPA matters more than light. And when in fact we have good measures of EPA, it in fact matters more than MVPA in children with respect to metabolic health outcomes. That's our data set, and we may be a unique data set.
I think that that's a really important question, and it's not answered in the literature. I think you heard that the recommendations are all focused on MVPA, and in fact, much of the science looking at metabolic improvement is also focused on MVPA. We haven't fully explored, or perhaps it hasn't been published, so there could be a publication bias, what the potential impact is of increasing mild physical activity. We right now are conducting a 7-year randomized controlled trial with 600 families, most of them Latino, and we have built our data set so we can ask and answer those exact questions. When I observe this in clinic, and when I observe this when I'm at Parks and Rec myself, that's a much easier lever to get to, is to change and shift from sedentary to mild. The question is, will it make a difference in terms of health?
Russ?
So to carry on with this point, which I think is a very important and interesting one.
Yes.
It seems to me sometimes we approach this issue almost from an algebraic standpoint, right? We try to add up the energy in and the energy out, and we expect it to balance somehow. And yet, you both just emphasized the apparent important value of moderate to vigorous physical activity. So if MVPA is particularly important to prevention of excessive weight gain, avoidance of obesity, do we think it's because that's a higher rate of energy expenditure that's associated with it, and it sort of adds up to more energy expenditure, or do we think it's some unique impact on regulation of weight status that may play out through you know, a whole set of responses associated with that participation in more intense activity? And I think this has important implications for programming, right?
Sure.
I mean, if there is something really unique about moderate to vigorous activity, then maybe we need to go there with kids.
Well, this is actually a semi-repeat of what I just said with a variation on the theme, but you know, we have really tried to do different types of substitutions, and even at the same level of energy expenditure, MVPA seems more important, and VPA seems more important still. So for the moment, I'm thinking there's something happening regulatorily that makes it unique.
And I'm a really practical person, so I look at this question from two perspectives. One is, what is the effect on metabolism, and not just short-term, but long-term? And that's the first question. And we know that MVPA, especially when you're quite young, is setting up a lot of systems. So it's helping to establish bone density. It's helping to establish muscle mass. There's some debate about how it's affecting metabolism and metabolism set points. Depending on that literature, you might view it differently, but that's one element of that question. There is no doubt that MVPA has really important effects for health, not just short-term, but long-term. But I think it doesn't mean that mild physical activity doesn't also have a benefit. And we just haven't been able to answer that question. So here's the practical piece of that. If we're trying to change people's behaviors, and already 40% of preschoolers are overweight or obese that are Latinos in my community, then getting somebody from sedentary to MVPA is not going to happen like a light switch. I have to encourage and work with families so that we move along the gradient. And I would posit that moving in the right direction along that gradient has many health benefits, regardless of whether it's demonstrated in your BMI.
We have time for two more questions. Eduardo?
Very nice presentations. In the previous panel, one of the slides compared density of physical activity opportunities with decreased obesity. And you talked about the importance of educating families about the presence of recreational centers in their communities. And so I wonder, as I thought about the question that Howell asked about a policy change, would that suggest that a reasonable policy direction is to increase the density of recreational facilities in those low-density places, one, and two, to do the things that, A, change the perception that there's too many stray dogs in the neighborhood on the one hand, and how to use those facilities might move all of us in the direction that you just talked about, from 0 minutes to 5 minutes of activity, and family as the unit of change as opposed to individuals.
Right? Yeah, absolutely. This notion, it's really not about education, it's about skills. So I didn't get a chance to present all of our findings when we conducted a grant funded by the Robert Wood Johnson Foundation called Salud America. But what we were able to do was we could look at how many times did we need to get them through the door before they became regular users, where they saw that that recreation center was meant for them and could build physical activity regularly for themselves and their children. And so we did sort of a sensitivity analysis. How many times did they had to walk through the door? And what we learned is just get them in once and teach them where things are. What do I need to wear? What classes can I bring a child to? Really basic, practical things. Just building it is not enough. Teaching people how to use these environments is critical. And then my last point there would be for policies, if we look at Parks and Rec or after-school programs, to create more of an ease so that you can have family-based programming. And we've incorporated that into our current trial. We've developed, working with Parks and Rec, some specific programs that allow you to be physically active with your child. So you don't have to worry about whether you have 5 other children who you need to attend to. Everybody can come and be physically active.
Final question.
Yeah, Rachel Ballard from NIH. We increasingly are understanding how important it is to start very early in this space. Can you comment on whether we have any evidence of whether physical activity during pregnancy has any effect on programming those children to actually become, we hope, addicted to physical activity as they grow?
Well, I think that's a really interesting question, and there are many different types of science that I think have been started to be applied to that. So first, what is appropriate amount of physical activity during pregnancy? Second, when does it need to happen? First, second, third trimester. So timing, intensity, really important questions. So when you look at the literature, you don't really have an apples to apples comparison yet. There's some interesting work in this space of epigenetics and how your environment, your food and physical environment is affecting how your placenta functions and what's being sent across to your fetus, as well as how you're flipping some switches on and off potentially in that fetus that will then go on to later predict adiposity at age 3. And so it does seem that physical activity, certainly in rodent models, we know less and have less robust science in human models, seems to be a powerful mechanism to improve health for both mothers and offspring.
So despite the odds at the end of the first quarter, we're tied. We're going to now take a brief recess. We have until 12:45. There will be a very hard start at 12:45, and I'm told that at that time Loretta DiPietro is actually going to answer many of your questions in the first 2 minutes. So you'll want to be here at 12:45. There's a cafeteria downstairs. There are stairs that you can take. Please join me in thanking this excellent panel.
Thank you.